Hello, my name is Dr. Jeffrey King, and I'm a board-certified orthopedic hand surgeon, and I'd like to talk to you a little bit today about thumb joint arthritis. So, the thumb joint at the base of the thumb is the most common site of arthritis in the hand, and the most common presentation of this is pain. It happens more often in women than men, and the magic age is about 50. Generally, after 50 is when we start to see the symptoms. Patients may present with a little lump or a fullness at the base of their thumb, but more often it's pain with pinching and gripping, or pain if they get bumped, if they're pulling on tight gloves, something like that. So the problem that we're seeing is that they're starting to get some wear and tear at the base of the thumb joint. This joint is what's called a saddle joint, and the saddle joint is kind of exactly what it sounds like. So the one side of the bone looks like a saddle on a horse, and the other bone that fits on top of it is kind of like the rider in the saddle. So when you bend your thumb forward and backward, that's like the rider going forward and backward in the saddle. And when you move your thumb side to side, that's like a rider going sideways in the saddle. Now, when everything is working perfectly, it's a very elegant joint and it works just fine. Now, what happens over time, and it seems to happen in virtually everyone, is that that perfectly smooth, perfectly shaped joint starts to wear out. And as it starts to wear out, instead of looking like a saddle, it starts to get flatter. And so instead of following the pattern it did before, it now sort of starts to skid around. And when it starts to skid around, that's what can cause the sharp pain. So if you go to pinch something, you feel like somebody stabbed you with an ice pick, that's probably what's going on in there. It also creates a little bit of looseness in the joint, which is why the bone here starts to move out, and that's what gives you the lump in your hand. Okay. Now, a couple of common questions. Why is it happening on my left hand when I'm right-handed? Well, it doesn't show a predilection. It doesn't show a preference for your dominant hand, so it can happen in either hand. The other question I get asked is, well, I didn't do a hard job, I wasn't working in construction, and that doesn't seem to be an issue either. So certainly heavy activity can aggravate it, but it doesn't seem to cause the problem. There probably is a genetic component, and it probably does run in families to some extent. So now that we've established the diagnosis based on history and examination, we can do some x-rays, and that can often show some joint space narrowing and some bone spurs. But the x-rays don't really drive the treatment very much, because the x-ray, how your x-ray looks doesn't always correlate with how your thumb is feeling. Sometimes people's x-rays look pretty good and they're very, very sore. And sometimes people have terrible looking x-rays and things aren't doing too badly clinically. One of the important things about this kind of arthritis is it's one of the few places in the body that I'm aware of that we know that in some people over time, the soreness associated with the arthritis can kind of burn itself out and stop hurting. Now, how do we know that? We know that because I see lots of patients who might be in their 60s, 70s, 80s who come in for a different problem. We get an x-ray, it shows severe arthritis. They might have a funny bump on their thumb, and their thumb might be a bit stiff, but they'll tell me it doesn't hurt anymore. So I can't guarantee that that would be the case for you or how long it would take, but we know that that certainly can happen and does happen. Now, with that information, it doesn't mean you have to be miserable, but it's something to factor in when you're thinking about how we're going to treat this. So that being said, how do we treat this problem? Well, we usually take a stepwise approach. And one of the first things that we often try is we'll try splinting or bracing the thumb. Now, if you've ever gotten a brace from a drugstore or something with a big brace that goes around your thumb and it comes way up on your arm and you say, my gosh, I can't do that. It interferes with my ability to use my hand. We get it. That's not the brace we're talking about. There are several much smaller dedicated braces that just support this joint and they kind of fit in your hand. There's ones that are made out of neoprene, so they're soft. There's ones they can make out of plastic, so they're hard, but there are multiple options to stabilize that joint so it doesn't skid around, and those can be very helpful. So the combination of wearing a brace when you're doing things that bother you, and perhaps trying to figure out how to do things differently, like twisting off bottle caps can be very difficult, or picking up a book like this could be very difficult, but if you pick it up that way, it doesn't bother you. So splinting and modifying your activity can be one way to try and effectively manage your symptoms. if you've tried that, it doesn't seem to be working, it doesn't seem to be helping, another treatment option is a steroid injection. So using a very small needle, we can inject steroid medicine kind of right into that joint right there. It's usually a combination of some local anesthesia, like you would get at the dentist, and then some steroid medicine. The local anesthesia usually makes it feel better quickly, but only for a couple hours. And the steroid medication usually takes 2 or 3 days, but gradually can make it feel much better. We would still recommend using the SPLINT with that as well. Now, the likelihood that the steroid injection is going to make you painless forever is pretty unlikely. It's not going to cure your arthritis. It's not going to make the problem go away. It's just going to make you feel better because we've decreased the swelling and inflammation in your joint. So you still have to be a bit careful because you can still aggravate the joint, but it certainly can provide some pain relief for some period of time. It might be a few months, it might be a year, probably isn't going to be forever. So we've talked about splinting, activity modification, steroid injections, which leads us to kind of the final pathway, which is surgery. Surgery has for a long time been a very successful treatment for this problem. There are many different kinds of surgeries for this problem, but there's one basic premise, which is getting rid of one of the bones that causes the arthritis and then doing something to stabilize your thumb. So your surgeon can talk to you about the different treatment options, and many of us were treated with one technique or a different technique, but the idea is to get rid of the rubbing surfaces and stabilize the thumb. And that for a long time has been sort of the workhorse operation that we use for a lot of people. There are 2 other operations that also have a place in management of this problem. If you are younger and doing heavy work, so require strong pinch, and you're going to be doing that repeatedly, another option is a fusion, and that's where your joint is kind of rubbing and bad. We do an operation where we clean the joint out, and then we put a little plate and screws or staples across there to take that joint away. So that decreases your mobility, but it makes the pain better and it gives you significant strength. It's a great operation for some people, particularly people that need powerful, durable, long-term pinch. But for most of my patients, they value the mobility over the power. So that's a decision that you can talk about. And then the third option, which has been around for a long time, but has had a kind of so-so track record, has been joint replacement surgery, either partial or complete joint replacement of this joint. Now, you're probably familiar with hip joint replacement and knee joint replacement, even shoulder joint replacement. And there have been thumb joint replacements around for at least 30 years, but most of them have had all kinds of problems and have not been widely used. Recently, there are new designs that show promise, but they do not have a long track record yet. So we don't have 10, 15, 20-year follow-up like we do with many of our other joint replacements. So that may be something that we look at more in the future as an opportunity to maintain mobility, but have greater pinch and grip strength. But right now, I would say that's sort of a small percentage of the surgery that I do for patients with this problem. So to summarize, thumb arthritis and pain at the base of your thumb is a very, very common problem. We have a bunch of different ways to treat it. We almost always start with conservative treatment, meaning splints and modifying your activity, and then we can kind of work our way up the ladder in terms of more aggressive treatments if your symptoms warrant. And if you can kind of get through this with splinting and modifying your activity and avoid surgery and get to a point where it doesn't really hurt you, that's great. That's a wonderful place to be. But the surgeries do work. They can be very helpful. There are risks associated with any surgery. I encourage you to take a look at the video entitled Risks of Upper Extremity Surgery for a better description of those. And most importantly, I encourage you to meet with your hand surgeon and talk about what the different options are, confirm the diagnosis, ask all the questions you need, get all the information you can, and that can make it much easier to make a decision that will hopefully improve your symptoms and your quality of life. Thank you.